Hey YouTube, it's Courtney. Coming to you with a quick little update. Last I came to you, I was drugged up. I've been told I looked kind of, I look bad, so I had some issues with swelling and we thought there might be some problems with my seroma. So I'm just going to go through what happened, and then, yeah, you also get a body shot at the end of this, so stay tuned. So I went to work for the first time in the actual office on Monday. I woke up, I was fine, I looked good, I was flat. I thought I was fine. And on my way to work, I noticed that I was feeling really uncomfortable and I didn't feel great. I was nauseous, I was having trouble eating, just general crap. By the time I got to work, I was feeling pretty rough. I took off my binder and I looked and I was very, very swollen. I looked 3 or 4 months pregnant. If you follow me on Instagram, vsgredesignme, you can see like the difference between the two, between like Friday and Monday. It was significant. So I'd been having issues with the seroma, and it's a minor complication. It happens. They say around 10%, but I've noticed it's been higher in bariatric patients, and I don't know why that is. Just from like what I've seen, from what I've heard from people, it's not uncommon. I know several people that have had it. It's just a pocket of swelling that happens between your abdomen wall and your fat wall, where the it's like in between the two, and it's just fluid that builds up, and when you touch it on your skin side, it waves like a waterbed, so it looks like this, and that's how you know it's a seroma and it's not just normal swelling. So I've had 2 drainings prior to yesterday, and each time he was getting lower, so we just had scheduled a draining for yesterday and we thought it would be fine. Well, the swelling was so bad, but it wasn't waving, and I wasn't feeling well and I was really uncomfortable, so he had given me the option of either going to the emergency room to see him in Brooklyn or waiting until tomorrow, or yesterday at the time, to see him in the office for a procedure, and he wanted to put a drain in. That night, after I made my video, I went to sleep. I was really tired and didn't feel good. I was lethargic. I ended up spiking a fever to around 100.5, and I texted my doctor and he responded right away and he said it was fine, just to take some Tylenol and that he'd see me yesterday, which is what I did. My fever broke probably an hour or 2 after I took the Tylenol. But I was uncomfortable. I managed to eat a little bit that night. Next day I wasn't really hungry, so this is yesterday. I had my appointment at 4:45 yesterday afternoon. He went and he saw me, and they had prepped everything to put a drain in, and he thought for sure that's what he was going to have to do, but when he did the examination, he said that he didn't feel like I had enough fluid to warrant the sorry, work emails. And text messages. So he felt like I didn't have enough fluid to warrant an actual drain input, and he felt like my seroma wasn't what was causing the issue. So he did an aspiration on it with a needle like he had been doing. And he only got 30 cc's from the actual seroma, so it was regular swelling, which could have been anything. I was a lot more active over the weekend. It is what it is. The swelling's a lot more, it's decreased a lot today. I still don't feel great though, so I asked like, well, fever? Like, where did that come from? The best guess is that I have a virus and I'm just fighting it off, and it happened to correspond with going back to work and the swelling, so just kind of this weird trifecta of things that were going on, and I have my period, and so it is what it is. I'm definitely better off today. I'm still not feeling great. I'm able to eat more, but my sleeve is really tight and it cramps up when I eat, and I get a little nauseous afterwards. I've been taking Zofran to deal with that. I've been taking a Percocet at night because the swelling was uncomfortable. I probably won't do that tonight. But I'm glad I didn't have to have a drain put in. That was good. But it's been kind of weird. So, yeah. Good news that I don't have an infection from my seroma. It has nothing to do with my surgical site. I just happen to have a viral infection that's making me spike a fever. I haven't spiked a fever since Monday night. So, whatever it is, I think it's leaving my system. And I just need a few days to kind of recoup and take it easy. I'm still planning to go to Providence on Friday, so yeah, that's pretty much all I got. I just wanted to give an update because I know people were worried, but this is a completely normal complication. The seroma is not painful, so don't freak out. Like if you're planning on having a tummy tuck and you're watching this and you're like, oh my god, I don't want to have this problem. It's not painful. It's uncomfortable a little bit, just like normal swelling is. It's a little freaky because of the waterbed. You know if you have a seroma because it looks like a waterbed and it looks completely different from other swelling. And that's like the telltale sign that it's a seroma. And it does need to be drained right away because it can cause an infection, which can cause sepsis and a lot of other problems. But as long as you keep up on it and your surgeon takes care of it, it's fine. And if it's a small amount of fluid, your surgeon may not do anything at all. They may just let it go and let your body absorb it itself. But in my case, I had a significant amount of fluid. I had almost 200 cc's of fluid that he drained the first time. So it was important that it came out. And it was a really big pocket. It went like 2 inches above my incision and like 4 inches over. It was quite large. Now he's only getting like 30 cc's out, so it's definitely better. He said if it comes back again, which it hasn't yet, but if it does come back, he might want to inject it with an alcohol solution, which dries up the seroma and allows the abdomen wall and the fat wall to adhere back together, which sounds super painful. I'll let you know if I have to do that. Hopefully not. Sorry. I don't know where that came from. In terms of the actual aspiration of the seroma, he gave me lidocaine, but honestly I'm still numb, and where he was doing the injection, I couldn't feel it either way. Like I can't even feel touching. So if you get a seroma, it's good news that you're going to be numb and you probably won't be able to feel the injection for the aspiration. So it's not the worst thing that could happen. The drain would have been the worst thing for me. Like I just was dreading that. Like when I called my mom on Monday, I was crying. I was just like, I don't want to do this. It was so bad. I was not looking forward to it. So yeah, so I'm going to patch in at the end of this a video that I just shot of my breast incisions, what I look like without a bra on, covered, you won't be able to see anything, and my tummy tuck incision and the swelling where it is right now, which it's very good today. I haven't been wearing the garment today, mostly because it puts pressure on my sleeve and it's been uncomfortable, so I'll probably put it back on after this video. But for that, it's like the swelling's not too bad. I'm swelling a little bit in my hips, which happens when I sit and lay in bed a lot. So yeah, I think that's all I got, guys. Have a good day. Bye. Okay, so here I am with my 1 month, almost 5 weeks, it'll be 5 weeks tomorrow, body shot. This is me currently with no compression on, no anything, not even a bra. You see here, this is where my boobs sit. I wore black so you couldn't see my nipples, but that worked out well. So, since I don't talk much about my breasts and I don't put them on, I'm going to try to show you without giving you a nipple shot. So, right now, I have these incisions here. This here is just markings for my bra, from swelling. But this is my vertical incision. And then I have a small, very, very small opening still right here. It's where the anchor scar goes together, and it just causes a little bit of problems. But this one, as you can see, healed perfectly fine. I have a small stitch coming out right here. But I mean, I'm super happy. So this is, they're still a little hard, especially on the outside. And you can see that they're starting to drop here. Like they're a lot more pliable. So this is from the side. And then, so this is without. So if you watched my before video, you notice my breasts hung to here before, and now without a bra on. When I put a bra on, they're more like up in here. But I can't be unhappy with where I'm at with that. So this is my new belly button. It's completely new. It's not my belly button originally that I was born with. It is completely surgically done. It goes pretty deep. My pinky can fit in there. I'm really happy with it. I'll try to get a close up. You can see I still have stretch marks, but I've been putting cream on them. They look a little bit better than they have. That's the actual belly button. And then in terms of my scar, I'm going to flash. I'm sorry I haven't been able to shave just because of where the incision is and how low it is. So if I go, like, this is the end of my pubic bone, just to give you an idea of where it's at. I have some swelling still that's kind of rough in my hips. But he said that'll go down. I think I might dog ear here. I have a feeling we're going to have to do a minor revision. But otherwise, my incision is healing really, really well. I'm super happy with it. It's in the angry purple stage. But it's definitely smoothed out a lot. I still have a little bit of scarring that's healing right now. As you can see, this was really open for a while from the seroma, because the seroma has been building here. And it's gone right now. There's no waving at all. I'm completely hard. Yesterday, when I came home, I was like out to here. Now it's just a small little pocket of swelling. So that's a lot better. You can see it's less on this side. You can actually see that pocket of swelling right here. But overall, I'm like really, really happy with it. I mean, this is where my underwear usually sit. I'm just wearing boxer shorts right now. But you can see that swelling in my hips a little bit. But considering okay.